honor those lost to overdose in the past year. Today is a day for acknowledging the more than 2,000 people in Massachusetts that died to an overdose in 2019, and to show our support for the more than 2,000 families grappling with their absence. My name is Kavita Babu, and I am an emergency physician and medical toxicologist. In 2018, Dr. Dixon, the CEO of UMass Memorial Healthcare, appointed me his chief opioid officer and tasked me with finding ways to prevent deaths among the people served by our health system. This year has been disrupted by a pandemic that confronts us with illness and death, but also social isolation and loss of livelihood. We have seen friends lose their connection to long-term recovery. We have recently seen data showing that overdoses have increased nearly 20% across the country during the pandemic, and we continued the urgent work of preventing overdoses despite the all-consuming nature of COVID-19. The world has changed during the opioid crisis, and medicine has changed. As experts, families, and community members aggressively work to prevent overdose deaths, I would like to take a moment to talk about the efforts ongoing here at UMass Memorial. I would like to acknowledge Dr. Alan Brown and his team at the Bridge Clinic in Worcester. Through their provision of low-barrier access to treatment, his team has dedicated its resources to patients who often had nowhere to turn after an overdose. During the pandemic, Dr. Brown and the Bridge Clinic team rapidly migrated their service to an online platform, allowing them to care for patients anywhere in our health system, removing the barriers that transportation and finances can present. I would like to mention our Department of Emergency Medicine and our Department of Pharmacy, including Doctors Mazicki, Clive, Gilchrist, and McCabe. With support from the Bureau of Substance Abuse Services, our pharmacy team has made it possible to put Narcan into the hands of any emergency department patient presenting for or at high risk for an overdose. We have been working on protocols to streamline for our inpatients based on the work from experts across the system, including Doctors Kennedy, McCabe, Ponce, Martinez, and Callahan. Brittany Chapman and our team at the Overdose Prevention Fund continue to provide community education on addiction, stigma, and Narcan. And we look forward. In partnership with the Department of Health, Mass BSAS, the Kraft Foundation, and the City of Worcester, we will be starting a mobile addiction service in Worcester aimed at providing opioid use disorder care where it is most needed in 2021. This mobile service will allow us to provide evidence-based and compassionate care from a vehicle that allows us to reach patients that aren't able to find the treatment they need in traditional brick-and-mortar settings. We've trained over 80 providers for Suboxone prescribing during the pandemic alone, as we grow the number of clinicians able to provide access to life-saving medications for opioid use disorder. We have additional work in the pipeline. Our team is pursuing funding for a Leave Behind Naloxone or Narcan effort with support through new state emergency medical services protocols. When operational, our Leave Behind Narcan program will allow paramedics to distribute Narcan to individuals at risk for overdose, whether they agree to hospital transport or not. And we need your help. Please follow the Overdose Prevention Fund on Facebook to learn more about our efforts and opportunities to volunteer. Every year, this day energizes us and pushes us forward. We hold close the expectations of our patients, our friends, our neighbors, and the more than 2,000 new families that are grieving this year. We usually are able to gather and share our sorrow and hope, but in the era of the pandemic, we are here on behalf of the clinicians, families, and communities that care for people with addictions. I asked a friend and colleague if he would be willing to share part of his story on addiction, recovery, and loss. I have a small portion of it here, generously provided for today by Richie and Jeff from the Worcester Recovers Coalition. He says, "This is a public health crisis. When like an illness, people recover. When people recover, they help other people that were in their shoes, and that astronomically high number, albeit slowly, declines. I have lost countless people I love and have also seen countless people I love recover." Richie found recovery, and it saved him. In early sobriety, so many people advised him to move out of Worcester, the epicenter of his decade of hell. Instead, he leaned into that city. He found this community of great people that had risen like a phoenix from the ashes. From all walks of life, all ages, every ethnicity, people that had been cast aside by society as nothing but junkies, losers, hopeless, criminals, people that literally have been to hundreds of funerals for friends that could have been their own, people with the biggest hearts, people that realized that supporting one another was the only hope any one of them had, people that banded together and said, not so fast, not me, I'm not dying. Worcester almost killed him, and now it keeps him alive every day. Richie continues his recovery journey. Hi, Richie, if you're watching. In his words, with community, there is always hope. But he and his family continue to mourn the loss of their brother, Jeff, years after his overdose death. I asked a dear friend and role model, Julie, if she would share her thoughts today. Julie has been a model of strength, intelligence, good humor, and compassion for me for many years, and continues to be all of those things after the death of her son, Drew, to an overdose. She sent me a picture of her and Drew, full of love and happiness. She said, "This picture came up on my Facebook memories today. 6 years ago, I went down to Virginia to visit Drew. He was clean and sober, as evidenced by the sparkle and joy seen in his eyes. If I were to say anything, Drew was loved deeply, but addiction and the intense hold opioids create are no match for love. My son was happy, fun-loving, charming, generous, caring, loyal, well-mannered. He was courageous, intelligent, charismatic, talented, loving, kind-hearted, and a sweet soul whose life was cut short. The stigma of addiction erases all those wonderful traits, and the individual is now seen only as an addict. Drew was relevant, and his life mattered. So many young lives are lost, families left to pick up the pieces of their broken hearts. We parents are not supposed to outlive our children. Please remember that the people lost to overdose were loved." If we held a moment of silence for each one of these new flags, it would stretch on for 34 minutes, and this is just our state for 1 year. Would you please join me in this single representative moment of silence? I would now like to ask Ms. Brittany Chapman, the Associate Director of the Overdose Prevention Fund, to plant the last flag. Thank you for marking this day with us. We will work hard for our patients and community in the hopes of seeing fewer flags in 2021.